Well, the interview is still ongoing. We're on a break right now, but it's going okay.
What can you tell us about, obviously the former governor believes that a lot of the fault responsibility fell on the federal government. And he said that basically he was just doing what the federal government was asking him to do. But others have said that, a mandate is different than guidance from the federal government, and that this mandate was very different from what other states did. What are you getting from that?
Well, first let me reiterate that as the ranking member of the Select Subcommittee on the Coronavirus Pandemic, the Democrats take very seriously the issues that we're discussing here. We've asked questions on the counting of deaths and any course corrections that his administration attempted to do. We asked questions on testing and the ability to test accurately and the partnership with the federal government in providing the tests. And during the testimony, clearly stated that it was very difficult with working with the federal government, with President Trump minimizing the pandemic and politically felt as if any increase in numbers or deaths would have harmed him politically.
Does that sound like an honest person, though?
Who are you referring to?
If he thought that releasing the actual numbers would have harmed him politically,
no, I'm referring to Donald Trump. That Donald Trump. No.
Sorry.
I said that it was difficult and chaotic at the beginning of the pandemic in the testing process and identification for several factors, and one of the factors was that President Donald Trump minimized the pandemic. And he also thought that as the cases rose, that it would harm him politically, meaning President Donald Trump. So with those different factors, he had limited capacity with the testing, where all the states at that time were all on their own. There was no federal coordinated strategy at the time. And so he was just defining all the different factors that went into a state's testing program.
Have you been able to talk to the governor about his own administration undercounting the number of nursing home patients that died, and they were afraid that would also make them look bad?
So there was no mention as to whether or not that would make them look bad, but there was questioning about whether there was overcounting, there was questioning whether there was undercounting, and we questioned the remedies or the course corrections to get a more accurate counting of the deaths that were occurring at the time.
But Melissa DeRosa quite literally was on a call with Democratic lawmakers and said that they would use this to come after us.
So during that time, I don't know anything about that.
Okay. Thank you, sir.
Yeah.
I appreciate it.
Yeah. I don't know.
Can you tell us about the governor's responses? Is he being full-throated in providing information? Are you learning anything new?
Well, the governor is being very straightforward, and he's answering the questions to the best of his ability. Yeah.
Do you feel like he bears any responsibility? Is he showing remorse at all in there?
So the line of questioning was very specific, and he was answering those questions. That's all I can say.
But did you get a sense that he's showing remorse in there, that perhaps that he was
the pandemic was hard on he mentioned the pandemic was hard on everybody, including him and his constituents and our nation. So that's what he was mentioning.
But you don't believe that he bears any responsibility for what happened?
Are you asking me now directly as the congressman?
I'm just asking you.
Look, I think all of our leaders have a responsibility, especially during the crisis, to help manage and to help save as many lives as we possibly can. That's why, I'm the ranking member of this Select Subcommittee, to find the answers in order to create forward-looking solutions, in order to better prepare for the next pandemic when that happens, and to prevent any future pandemics from happening. So I do believe that every leader has a responsibility to their constituents that elected them to be in office, and he clearly there was demonstrating he was highly engaged. He's answering the questions to the best of his ability to answer our questions, the Democratic questions, as to the numbers of cases and the countings of hospital versus nursing home versus at-home deaths, and they looked at how they were making how they were counting those deaths, and they realized how they had to course correct and adjust for the numbers that were coming across.
So you're walking away with the impression that he did the best that he could.
That's what I'm walking away with right now.
Okay. Thank you, sir.
Yeah. No.